Okay, entonces, ¿qué te hicimos? So what did we do?
Me hicieron un BBL.
I had a BBL by Dr. Gabriel.
Ajá. Yeah, by Dr. Gabriel.
BBL by Dr. Gabriel.
Y
Okay.
liposucción.
And liposuction, huh? High definition liposculpture, huh?
Sí.
To what areas? ¿De qué áreas te hicimos?
La espalda, el
Alta
abdomen.
definición del abdomen, la
Y
espalda.
un poquito de la axila.
Y un poquito de la axila. So a little bit of the axilla and the entire abdomen and back. ¿Y hicimos una transferencia a las pompis?
Sí.
And a fat transfer to the buttocks. Te puedes dar la vueltita. Mira qué bien, qué bonita se ve. Te puedes poner los brazos arriba para que se vea mejor. Y darte la vueltita despacito. So you can see her profile. Her buttocks look very nice. Look at the linea alba and semilunar lines. Very athletic. Sigue dándole vueltita. She looks incredible. And the buttocks are very well defined, projected, nicely, soft and natural. ¿Contenta entonces? So happy? Would you recommend this procedure to other people? ¿Le recomendarías esto a otra gente?
Sí, definitivamente sí.
Yes, definitely, I would recommend it. ¿Y tuviste sangrado, dolor, morado, any bruising, bleeding, pain?
Un poquito de dolor y
minimal
morado.
pain
Minimal.
and minimal bruising. ¿Y te pusimos drenes o no? Did we put
No
any
drenes.
drains? So no drains. High definition liposculpture and a fat transfer to the buttocks. Y retuviste la gran mayoría de la grasa en las nalgas. Did you retain the great majority of fat to the graft to the buttocks?
Sí.
Yes. Wow. So that's important, you know. So we did this under ultrasound guidance according to the World Association of Gluteal Surgeons to keep this procedure safe. So we put the fat graft above the muscle in the deep subcutaneous space. And so the reason why she didn't lose much fat graft is because we take very good care of the fat graft with very small cannulas, non-aggressive cannulas, and we take our time so we don't destroy the fat before we put it in, and also much less risk of bleeding and much less trauma, so much less risk of us putting blood in the buttocks or oil in the buttocks. And so what we put is basically the intact, very well managed and aspirated fat graft. So you can see on the videos on YouTube that when I take the fat is yellow, and when I put it back in the buttocks it's also yellow. And we don't use any commercially available systems to process that fat, because normally what happens is that with the traditional technique, this liposuction is done aggressively with very big aggressive cannulas, very fast, multiple surgeons operating sometimes, and they can turn maybe 10 cases in one day. We only do one, but we do it very slowly, very carefully, and preserving that fat graft for you. So instead of us injecting twice the amount, counting that you're going to lose 50% or 35% of the fat, we inject what you want. And she wanted a modest augmentation, and that's what we do here, very safely, because if you do this blindly, traditionally this is done blindly, and if you do this blindly you can easily put the fat in the wrong place, accidentally or on purpose. You can put it into the muscle. In the muscle there's these big veins, the superior and inferior gluteal veins, and they're very close venous drainage system, and the fat graft literally gets sucked up into the inferior vena cava, which is probably the largest vessel in the body. It's about this big, and it goes right into the right atrium, into the pulmonary artery, into the lungs, and the patient dies suddenly. Almost nobody survives more than 24 hours. It usually happens intraoperatively or immediately after they turn the patient from the prone position into the supine position. And we never had that problem, thanks to God. We never had anybody die from any surgery, and we want to keep it that way. But the World Association of Gluteal Surgeons is incredible. I'm the CEO of that organization. We have about 25 countries from the very best surgeons in the world, and we're teaching doctors. We have multiple training centers in the United States and abroad teaching doctors how to do this safely under ultrasound guidance. Thank you.